Today is the first day of National Breast Cancer Awareness Month. Now, we know that breast cancer is all too common. In the U.S., 1 in 8 women will eventually develop the disease. Here to tell us more about early detection of breast cancer is Dr. Jonathan Shakespear with the Intermountain Medical Center Breast Care Center. Nice to have you on today.
Thank you for having me.
And so it's October. That's when we start to see all of these pink ribbons coming out and everyone talking about breast cancer. What do you want people to keep in mind, specifically women?
I think, just as you said, breast cancer is unfortunately a very common disease. Fortunately, though the rate of breast cancer is 1 out of 8 women will get breast cancer, the death rate from breast cancer is significantly lower than that.
Okay,
and mammography plays an important role in decreasing that death rate. We're all about early detection, finding breast cancer when it's small, finding breast cancer when it's very easy to treat.
But we also know that Utah ranks the lowest for women getting mammograms. So we know that this is common. We know that some women are more susceptible than others. Why are we seeing Utah at the bottom of that list?
Well, we wish we understood that a little bit better. The truth is that some women in Utah choose not to get mammograms, including women with health insurance. So they could get a mammogram at no or low cost, yet they choose not to. We don't exactly know why, but one theory that we talk about is that there's a misunderstanding about who should get mammography. Many women think about their own personal history and their family history, and they can't think of anyone who has breast cancer in their family, their grandparents, nobody they can think of.
Yeah.
And they know that they're living a healthful lifestyle as well, so they feel like they're in the low-risk group. But the important statistic that they need to know is that most of the women that we see are in the low-risk group. Most women with breast cancer who are diagnosed with breast cancer are considered low risk. So that means that mammography is important for everyone, not just women who are considered high risk, because most of the people who will end up being diagnosed are not in that group.
Okay, so even if you feel healthy, you look great, you still need to be cautious. When should we start getting mammograms?
So the American Cancer Society recommends starting mammography at age 40 and then getting a mammogram every year as long as you're in good health.
And we have 3D tomography now that is even better than the old mammography machines.
Yes, so 3D mammography is an exciting new technology. If you think of a mammogram as taking a picture of a book where all of the pages are transparent, you can see how that would be a hard picture to interpret because all of the letters would be overlapping. A 3D mammogram is a technique where we can turn the pages of that book and look at the pages individually. So it's a much better technique for finding breast cancer.
And I also heard that in 2016, so next year, all insurance companies will be covering that.
Yes, it's being more and more accepted, and coverage is increasing. So we're very excited about that.
Okay, so cost should not be a deterrent there. We'll put all the details about this on our website at goodforutah.com. You can also find more at Intermountain Medical Center Breast Care Center if you have any questions. Thanks for joining us today.
Yeah, my pleasure.